So a YouTube viewer just asked us about a droopy tip when she smiles, and what are the techniques available to take care of that?
That's probably one of the more common things that we end up seeing with patients. Most of the patients who we see who have a droopy tip tend to have just really poor tip support. That's really the main issue, the tip over time. You know, a lot of people think that the nose keeps growing, and the reality is that as we all get older, the tip loses some of the support, the connections between the tip itself and the septum start to elongate, and as that happens, the tip falls forward and down, and then when you smile and you don't have a whole lot of tip support, the depressor septum muscle itself pulls a little bit, and that causes the tip to droop a little bit more and exaggerates any hint of a bump that you have.
Yeah, there's some surgeons who just subscribe to the idea of really going in from a closed approach from inside the nose and cutting this muscle, the depressor muscle that pulls the tip down. It works to some extent in some patients. We find it's actually very unreliable in terms of the result it can have, but more importantly, it's often just treating the symptom of the problem. Cutting the muscle will reduce the amount of pulling of the tip, but in a tip that doesn't have enough support and that is droopy to begin with, you're not really solving the issue.
Yeah, and I think that's really the key. In our experience, it makes much more sense to get real tip support, whether that's by doing what we often use, which is a tongue and groove method where you suture the tip cartilage itself back to the septum, or use some sort of extension graft off of the septum to, again, allow the tip to be sutured to that. That's going to give you a whole lot of support, and most of the patients who are having these sorts of procedures are 20s, 30s, 40s even. You've got a long life ahead of you. There's no need to, get a procedure done that temporizes the problem, fixes it to some extent, but really doesn't address the main core issue, which is that the tip doesn't have support. That's where you're going to end up a year later, 2 years later, having to go back and get another revision.
Absolutely.